Today I'm talking with Dr. Neda Gioia from Integrative Vision in New Jersey. Dr. Gioia, thanks for joining me today. I appreciate it.
Thank you, Eric. I'm really excited to give you some nice insights about me.
Yeah, we're looking forward to it. Well, first off, tell us a little bit more about you have a specialized practice, and you have something an approach that you use called SEEHealth, which is, as I understand it, more of a holistic view of or a holistic approach to health, but that obviously includes eye health as well. But tell me a little bit more about that.
So when I started my practice, I roughly about 5 years ago, cold start, I had intentions. And those intentions were to really bring on this holistic view of the whole body within eye care as really the front line. And it was always there. And the goal was to be able to give and offer services that embrace holistic healthcare and integrative healthcare within the eye space. So, SEEHealth and also something called Eye Exam Plus were these concepts that I created to really try to bring that to my audience, my patients. And it involves expanded education on nutrition to the patients, expanded education in their nutritional levels, their nutrient values, other new testing that we do in functional medicine and in nutrition, and also the SEEHealth program to offer an infrastructure of support for those patients, which involves health coaching. It's a new dynamic in the eye care space for sure, but it's not within the nutrition and holistic space. So I'm just happy to be able to mix the two.
Okay, very good. So is this like a replacement for standard eye care, or is it more of an add-on enhancement for it?
No, and definitely it's a separate service. I do my standard eye care, although I have shifted to a concierge model. I do perform standard eye exams. Now we have more of that, as I said, concierge model where we don't take insurance, et cetera. And then we have these add-on programs. So it's not a part of the standard eye exam because it's impossible to execute something of this caliber during a standard eye exam.
Oh,
But it doesn't mean that you can't start placing those seeds within a standard eye exam, that this exists and these types of services and this type of angle to look at your health is out there and we can help provide that.
okay. All right. So this is interesting. So did you start out, because I know a lot of our listeners may be interested in this too, like, did you start out when you cold started in this concierge model? I think I heard you just say no, that you had shifted to it, but talk a little bit about that and the challenge, because I presume then you used to take vision plans. Is that right? When you first started?
Yeah, I'm very blessed. Prior to my cold start engagement, I was blessed with working within over 30 practices in the
Mm,
span of 18-ish plus years. And that was due to a lot of moves. But I take that as a positive because I saw so many different aspects of practices in terms of management, business structure, and over all those years, I always had a plan of I need something for myself. I always had that personality of being a creator because it's not really being a boss, it's being in that creation side of entrepreneurship. So I would take notes. And throughout all these years, what do practices do to start? How do they build? And when I started the practice that I am in now, Integrative Vision, I took all those points into consideration and I had benchmarks. So at X amount of years, I didn't want to take vision plans. At X amount of years, I wanted to shift to a different model. And it worked in the sense of, yeah, I first started with vision plans and general insurance. And that cultivated, I'm going to say, a very loyal attention because when patients walked in the door, although we were taking the insurance plans, they received a high level of service that maybe they weren't receiving on somewhere else that they were going to. So that cultivated this attention. And then we were able to convert that to patients that ultimately wanted to come to our practice no matter what. And I took that with a grain of salt because at the end of the day, we want to provide the best services that we can. And unfortunately, what I provide is not supported with a standard insurance plan anymore. Now I'm able to shift my model to a more niche kind of concept, as we were discussing. And also it allows me to take in all my experiences and help other practices, which is something that I've shifted to in the last year that I did not expect to happen this quickly too. So it's not that you don't take insurance, it's that you might be able to toggle a practice where you can have both models. And it's really inspiring. I love creation. I love figuring things out, and it's really opening up the eyes of not just the patients, but business owners, that there is this way that you can formulate another path for your patients within your own practice, whether you take insurance or not.
Oh, that's super interesting. You run more of a, I mean, you can, what you're saying is you have the possibility to run essentially like a hybrid model or a combination of the two. And does one become a more attractive option for the patient over the other? Or is it just providing, is the concierge side of that providing a model for those who mainly don't already have the vision insurance?
Yeah, so I would say what I'm trying to formulate is a way to basically add on to other practices. I always say you don't have to do what I do because, first of all, just my education level in nutrition is not always the most attainable for an average optometrist. And I'm very much aware of that. And I've done that really more for personal reasons, not just for practice and for professional reasons. Being able to navigate your education within eye care and nutrition, that's part one. And then part two is how do you execute that education? And just because we're concierge 100%, that doesn't mean that the practice has to be. I do it more for time management too, because I do toggle other positions in my life. And I'm happy that I'm able to toggle all these things right now because it just helps me grow. And I typically get bored. So I like to move on to projects. But now I'm able to fulfill more of that other part of my career path where I really like to help create infrastructure for other practices and create ways of getting this information to their patients. But my model is not necessarily, doesn't have to be replicated perfectly. It's really more of to prove that it's possible. And the joke was when I started my practice, I was like, this is my beta type. I'm testing it out. There's no goals. I'm just going to go with the journey. And I did have these benchmarks in mind, but it's very a gray area. There was no one before me do A, B, C, D, and you're going to get to whatever. And I almost like that even more because it tapped into my creative side. But yes, it doesn't have to be formulated exactly how I did it. It's just a matter of this is plausible, this is doable. And everyone's practice is different, whether you're in a model where you're within kind of like a large structure, a small private practice, a university-based practice. There are elements that can be plucked where you can actually execute nutritional services within your practice, I think.
Okay, interesting. So let's talk a little bit more about like the specialty. So I heard you say earlier that you had been in a lot of practices and had a broad range of experience through that. When did the idea for SEEHealth, because you said that was a method that you had created, right? Mm-hmm. When did you start to get kind of the initial thoughts of that idea? And then when did it actually become a fleshed out methodology that you were providing to others?
That's a great question. SEEHealth, just before it was named SEEHealth, in my mind was, how do I create nutritional functional medicine programs within my career path? I survived a very horrible, debilitating health scare in my early 30s. And I was blessed with meeting some practitioners that were proactive in integrative health, and I was saved by them. And that trigger of just knowing that there's another way of supporting your health besides surgical interventions, allopathic care, it sparked, I say it's a thirst that cannot be quenched. I decided my career path is optometry. I was an optometrist at that time, and I wasn't fulfilled. I'll be honest, I was burnt out. I worked too much. I was supporting my husband. There was a lot going on. And it probably also didn't help my health situation at the time. But when I saw this way of looking at healthcare and just practice how you offer health and wellness to your patients, at that point, I said, I can't go back to work the same. It's not, and it's never going to be the same. If I'm going to see patients, I want to be able to at least discuss these points or even go further and actually execute plans for them. That was pre-SEEHealth. And then when I started my practice, it was just more of thinking of ideas of how to label this system of integrative nutrition in my practice. And I again, going back to my creative side, SEEHealth was just something that I thought of because it toggles vision and health. Same thing with my practice name, Integrative Vision. Vision doesn't necessarily mean your eyesight. It's also a vision. And it was really, the purpose of it was because I had a vision. So that was really the motivation for SEEHealth. It was personal. Most of what I've done with my career path and my second career path, I always say, is a personal kind of fulfillment.
Well, that's a great place to be, right? Because so many people can get stuck in that unfulfilled cycle, but they're not, maybe best way to put it is not tapping into that creative side as much as you, or not feeling like they have the time or energy to kind of step back from their current cycle and lifestyle of maybe it is like you were getting burnt out, working too much, a lot of things going on. And how do you like pull yourself out of that and really start to figure out a different way forward that will be more fulfilling or be more in alignment with goals that are very personal to you? So that's a lot of times that's where our biggest inspirations come from. And I feel like yours, as you've said, is overcoming this debilitating disease or challenge or health issue that you had earlier on, and kind of taken that and launched forward with a program that helps people, maybe not exactly the same way, but similar ways for sure, right? To try and overcome and maybe not fall into those same cycles in their lives. So no, that's very fascinating. Let's see. So what were, as you're getting the whole concept of SEEHealth and this integrated vision up and going, like what were some of the biggest challenges you faced kind of it could be either in developing the system or gaining traction with this business and this business model? As I know you said has worked out well for you, and this was a beta tester, but there must have been challenges along the way that you had to overcome.
100%. I think anyone who's out there who's an entrepreneur, especially if you start anything cold, I think you almost expect consistent challenges along the way. I mean, you have to think, I launched my cold start practice less than 6 months before COVID shut down. It was, talk about whammies, right?
Yeah.
But what did COVID do? COVID made us realize that we need to start thinking about our health. So even though obviously surface, that's a horrible thing, getting deep down into it, now your patients are a little bit more attentive to, hey, what is my vitamin D level? Maybe we should start thinking about some food improvements. So that was a huge challenge. And what did I do during that challenge? I was not a very digital savvy person. And when I say digital, social media, that was not it was not my wheelhouse. I always joke, I just put my head down and studied. And then during COVID, there was this time lapse. And I said, you know what? Let me get on these social media outlets and let me start talking about what I do. And that sparked some new relationships, some advanced experiences with digital platforms, and some attention locally by various media groups, etc. I also figured out the profound value of just personal relationships. And when you believe in yourself and you start building those personal relationships within your community, you really can trigger growth in your business. So collaborating with healthcare providers that weren't in the eye care space was huge, because when somebody's in the same mindset, whether they're a chiropractor, health coaching, et cetera, and they want to be able to converse with somebody that's able to talk to them about nutrition, opening up these huge referral funnels because I provided something that they don't provide, which is the eye care part, was also a challenge, but turned into a great system. And then the biggest challenge is always what? I think in any business, it's always staffing. So having the staffing challenges, and I've been able to shift my way of hiring. I think we have to also think that there's this different types of staffing options. And I've been really successful with staffing with more of the health coach minded group of folks. So that's helped. But again, it was all trial and error. It didn't come to me intuitively. It was just, hey, this is not working, move on. And I think that's one of the key factors, is not to get stuck. If you make a mistake, if something doesn't work out, if you do these, there's so many mini fails, I call them, and you just have to blow it off and keep going. And that's, the challenges were so immense, and they still are. There's no day that I don't feel like I'm not thinking of ways to improve what we have or shift, et cetera. But that's what I love about being on this side. It actually fulfills me. Yeah, challenges are accepted.
Challenge accepted. There you go. Yeah, it's almost like different people think of it in different ways, but it's almost at some point the business side of it and this trial and error and everything is almost like a game at some point, right? It's trying different things. And like you said, if things aren't working out or that path is not working, you have to be able to shift until you can stack up some wins and then build upon those. But you got to almost is a prerequisite to go through some of the losses and some of the fails first, right? To figure out, otherwise we don't know what does work.
Right.
This really relates to something you were saying earlier too about your benchmarks, and you didn't have like strict goals or like huge, super specific goals, I think you said, but you were just like, you had some benchmarks you were following and you were seeing where you could take it from there in this kind of beta test concept. And I think with all the coaches or consultants or even just resources out there who are trying to either put things in books or productize things, there's still like, you can have a general framework, but there's still a very defined, or sorry, you can have the framework that is defined, is what I was trying to say, but you still have all these other variables that like nobody's exact business journey is the same next to the other one, even if they're doing the exact same thing. So you have to be able to work through those things because, again, you can get ideas and frameworks, but it's your execution and the trial and error and all the things that you were just talking about that really propel you forward as well. Do you agree with that?
100%. And especially in, obviously, my wheelhouse is optometry practices typically,
Mhm.
and being able to work within so many different practice models, knowing that, listen, A is not going to work in this person's office, but B might work because they're just different locations. I've worked in 3 different states, different. So absolutely, you cannot, I don't think there's a blueprint for success that you have to follow. It's like a blueprint that you have on AutoCAD and you keep fixing it. That's really what it is. So in my interpretation, but again, it's a lot of work and you have to just be faithful, that you have to believe in yourself. And I always say, fear one thing, and it's yourself, because ultimately you can manage what is put in front of you if you go at it in different angles.
I know we're coming up on to the end of our time together, and so I want to be respectful of your time, but I just always close out, or usually do anyways, with a question that you may have already stated, and it may be worth repeating or even elaborating on if it's possible. Or sometimes when I ask this, we get a whole new idea that just hasn't come up in the course of our conversation yet. So I just like to ask you, what is one piece of advice that you give to others on their journey through business ownership in the optometry?
That's a very good question. And of course, it's so hard to pick one thing always.
Yeah.
I alluded to it before. I think it's the fear of learning. So you have to learn. You can't you just have to keep learning. And when I use the word learning, I don't necessarily mean school education, which I'm very big supporter of, but learning about whether it's artificial intelligence. I know that's a scary word for some, advancing their computer systems, all of these basic things. You have to keep learning and you have to just adjust with the times. I think a lot of practices get stuck because we like to float sometimes, and that's okay, but don't stop learning. I think that's the key that I've learned in this path.
Very good. That's awesome. And I couldn't agree more with that. That's a great place to end our conversation for today. And I sure hope our paths do cross again in the future, because I feel like you have a lot of insights and experiences that you could bring here that would be of a real value and real help. So thank you for your time today, Neda. I really appreciate it. And I hope to talk to you again soon.
Thank you so much, Eric. And I'm really happy that we did this. This is exciting.
Very good. Thank